Thank you for joining us, Siouxlanders, for this special news cut-in. I'm Matthew White. The Siouxland District Health Department is just moments away from giving an update on the COVID-19 outbreak in the area. So far, there have been 2 confirmed cases of the coronavirus here in Woodbury County. So now let's send it over to the press conference for that update.
Next phase of our community's response related to the COVID-19. COVID-19 testing has been occurring in the Siouxland community for a period of time. What we are looking at is the opportunity to be able to increase the capacity to be able to do this testing, as our community has been asking. One of the things, though, we have to take a look at, the testing still falls under the expectation that they meet the criteria and they're symptomatic before the testing order will be issued. So we will not be able to test all 103,000 plus of Siouxland residents. We're looking at doing this in an organized fashion. One of the things we're looking at is we're pleased to announce today that we're going to initiate this process tomorrow on Friday, March 27th. In planning for this site, there were a couple of priority areas that we had to take a look at and that we wanted to address, and that was the motivation for the partners that you see behind me meeting together to figure out what is going to be our process. First off, we wanted to make sure that those individuals that were definitely needing tested had access to it. Second, we really needed to take a look because even at the national level, there is a shortage of personal protective equipment. We wanted to take a look about what could we do for strategies to reduce our consumption as a community and specifically related to the testing. And thirdly, then, we wanted to take a look at limiting what may be an ill person's exposures to other people and other places. So all testing done at this new clinic location must be ordered by an individual's primary care physician. This order or this instruction or approval to do this can be by calling their primary care physician. They will meet with them. They may do it telehealth, over the telephone. They will do a symptom assessment. If the primary care provider or their physician thinks they are eligible and determines that, they will then issue an order, which is a standard medical procedure. With this order then, that will be submitted to one collective point, and within that collecting point, appointments will be scheduled. Patients then, eligible for testing, will then be sent a communication via text or some other means that gives them the information related on where to report and what time their testing appointment is. We ask that the public cooperate in the aspect of not bogging down our location in that by showing up without the appropriate authorization. Medical providers, once they have this submitted, then they will actually commit and they will do the testing, specimen collecting. And as I want to reemphasize, only individuals with the appropriate orders will be allowed into the testing queue, as we call it. So we want to make sure that that's something that's followed and everyone's understanding of that. One of the things also, I am Kevin Green here from Siouxland District Health Department, but the Health Department is not the entity that's doing the testing and we don't have the availability to do it. And I just share that because calling us, we will refer you back to your primary care provider. But we are the ones that have vested interest in working with these partners to assure that this occurs and the service is available to our community. The partners that have been sitting around the table planning this over the last 10 days, they include the Family Health Care of Siouxland Clinic Networks, Mercy One Clinics, Prairie Pediatrics, Siouxland Medical Education Foundation, Siouxland Community Health Center, and Unity Point St. Luke's. It is really through their combined efforts that we are able to offer this to the community. We want to also remind everyone that are just mildly ill from either COVID-19 are normally able to recover at home. Those are the situations where we would not be requesting testing. Many people will not need to seek medical care or be tested to confirm they have it. And one of the rules of thumbs we heard, because we also learned from the media messaging, anyone who is experiencing respiratory illness, whether diagnosed or not, needs to follow these same recommendations. If you're ill, stay home and isolate from others, even within your house, until 1, you have had no fever for a minimum of 72 hours, and that means without any fever-reducing medication, and other symptoms have improved. For example, when your cough or shortness of breath is improved, and then at least 7 days from the time the symptoms first appeared. Those are all strategies that anyone that is mildly ill would be able to incorporate within their own practice. In addition, family members or other close contacts, either of a suspected or confirmed case, should stay at home and self-isolate for those 14 days. That's been the common message that we've shared all along. Siouxland District Health Department, we're also working to clarify the number of tests that have been conducted within our community. With the addition of private labs that can do the test, the total number of tests done in Iowa and Woodbury County specifically have not been something that we've had readily available. We apologize for you. We know that's data that you would like to have. We just don't have it available at this time. And anything we would share would only be estimates and not specific numbers. The labs are now slowly beginning to report the total number of tests done and not just the positive results. So this data is becoming more available, and we're working to clarify what our testing numbers are, and we'll share more when the numbers are available. So at this point in time, I would open up to any questions that any of you at media personnel may have.
So Kevin, you said you don't want the public to come to the new test location and they'll be told where, but I noticed you also haven't given out that location. So do you want that publicly known then?
No, there's no reason, because what we will do in the internal communication process is, first you call your primary care physician. They do an assessment of the symptoms and determine if you're eligible for the test. They issue what is a paper called a set of orders. That is then transmitted into a central collecting entity, and that they then will be communicating out directly to the patients when and where they actually report. And at this point in time, we're not releasing the address, because we just don't want the public showing up and getting in the way of us being able to do this service. So it's really those that are going to receive the test will be getting that information.
And you're looking for people to be tested, those with more severe symptoms, you're telling a lot of people still, if you've got minor symptoms, still stay home, just shelter in place, but people being tested would probably be a little more severe cases then.
That would be, if their medical provider indicates that they're eligible for testing, our assumption would be yes, the symptoms are probably a little worse, but that comes underneath what that primary physician would actually determine. What's the right action for that individual? Other questions?
Can you tell us how many ventilators are available in Woodbury County?
That is not a number. I guess that would be something we'd have to request of the hospitals to know number of ventilators. I'm not aware of that right now.
Why did you decide to open the clinic now? What is the reason for this?
The reason for doing it, that has always been our intent, is there's been the question about getting additional testing available within the community, and two main factors took into consideration. One is, if we do individual tests at every clinic, that consumes one full garb of what we call personal protective equipment. If we do this joint testing, is what it was, there are parameters they can use so that they're able to switch that out on the safety of the healthcare provider and also upon the safety of the patient. And so it preserves what that's been identified as a valuable resource. The other part is, as all of you know, as we've talked about with the social distancing, the self-isolating, we do not want ill people in locations where they're going to be interacting with potentially not ill or less symptomatic. And so this also provides, because the individuals will not even exit their car. They will actually stay within their automobile, and they will do that drive-through. And we're looking at minimizing any sort of exposure to other audiences in the general public. And so those are probably two of the main priorities and reasons why we took a look at some practice or approach like this.
Is this a clinic that other people commonly are visiting? Will they not be able to go into this clinic? I know you mentioned this testing is happening in people's cars. They won't be going into the clinic, but is this clinic open to regular people?
We have set up a site. Is actually what it was, is it will be pretty much dedicated towards the automobile passing through. And that, so yes, it's affiliated with the functioning center is what it would be, but it just is a separate entity that's been put together so that these cars can travel through there, and it minimizes the risk to the general public or any waiting rooms, that type of thing.
No other other cases. We still holding with 2 confirmed for Woodbury.
At this point in time, I understand we're with 2 confirmed. We'll see when we get the additional report. For those case increases and any changes in that, Siouxland District Health Department has on their Facebook site, we will post an additional update. So any additional cases will be released through that mechanism.
Any involvement with any of the agencies here as far as yesterday with the warming shelter closing? Talking to a couple of people from there, they were saying, where do we go now? Or are you involved with any of that resource allocation as far as where people that don't have a homeless shelter now to go at night?
I think one of the areas with the homeless shelter that as far as what we had for discussions with them and their board, that board, not speaking of it, but it was a difficult decision. And that is one of the areas of concern, that is a very congregated, close quarters. And so when you talk about social distancing, 6 feet, that is not a potential. When they're staying there for multiple hours, that's sort of an area that they too are concerned. But as far as a warming shelter and additional services, those will be, there's projects out there like the street medicine that's doing some of the health things. They'll try to intervene with those. And then there are a number of those that actually do have health care that they're receiving through local providers. And many of those are served through the Siouxland Community Health Center, which is a part of the work and the function that they do, along with other clinics.
So since the information released this morning showed no new cases in Woodbury County, do you expect our numbers to come up here soon?
What I would say is anytime that we get more test results back, any one of those individual tests is a potential for an additional case. So we're anticipating and probably figuring that our numbers of confirmed cases will increase. And so that's just a reality. When you spread the net further, you're probably going to catch more.
Are you seeing Nebraska residents coming over the river to be tested, or is that allowed?
As far as Nebraska residents and out of state, if they are set up with their primary care physician in any one of these clinic networks, those individuals are basically eligible to go through this testing process. So we do not exclude them. We have to remember that this changed, the state hygienic lab qualifications were originally, and they've modified that. They've understood that since we're in a tri-state area, they're just looking at getting tests done to see what the status of it is in Siouxland.
So you do not have to be an Iowa resident to get this testing?
No. If you've gone through the primary care physician of your choice, then they're linked into this network, they can do those referrals. Any other questions? If not, I'd like to thank the partners that stood up here or standing up here with me today. I think it's important, one of the things that we get out to the population is the fact that there is no individual approaches. We're looking at a group and collective approach. We think that's the best way that we can address the needs of the community. And like I said, with anything we do is our core messaging is the self-isolating, continue to follow that. Follow the guidance of your healthcare provider if you are seeking or not feeling well. And I think those are the things that we can really look at, and take care of yourselves within your homes if at all possible.
I have another question. So I guess when people come over, if they're from Nebraska or South Dakota, would that positive test result be confirmed for their home county or for Woodbury County?
All of the test results, they go in 2 different directions. One is their primary care provider will be provided the test results. That's a standard of practice that exists. But if they do come over from South Dakota or Nebraska, those test results will go back into their appropriate public health systems. But we're in contact with them, and I have a feeling that if any of those come about, we're waiting for that to happen, we'll probably get a heads up because we interact with them regularly.
So that wouldn't increase Woodbury County's numbers?
No, it would not increase Woodbury County's numbers just at the testing. We go back to what we call resident data that is tracked with their zip code. Any other questions? If not, we want to thank you for being here today, sharing the information, and we look forward to your continued support as we as a community address this issue that's facing us.
Again, that was the Siouxland District Health Department giving us an update on the COVID-19 outbreak. And here's a quick recap of what was shared. Per Kevin Green with the Siouxland District Health Department, organized testing for COVID-19 in Woodbury County begins tomorrow, March 27th. Now, testing must be ordered by your primary care physician by the phone or an in-person meeting. At that time, an assessment by your physician determines if you qualify for testing. You'll then be texted by phone the time and location of your appointment. Now, Siouxland District Health is not doing the testing. When you go to testing, you'll stay in your automobile for the testing, simply like a drive-through. And lastly, if you are ill, you are still encouraged to stay isolated even inside your home. But we will now resume our ABC programming. Thank you so much again for joining us, and we hope you have a great day, Siouxland.